Yo, welcome to Play Free FC. This is real conversations with the people who shape the game of soccer. Today's episode is a big one for me. I'm sitting down with Pete Zulia, co-founder of Oxford Physical Therapy. He's a board certified sports clinical specialist and honestly just one of the best in the game. Great guy, insane professional when it comes to the details of rehab and getting athletes back the right way. He's also my guy. He got me through 2 ACLs and multiple knee surgeries while I was in college. So this one's personal. And what we get into here, especially around ACL injuries in the women's game, this is the stuff that people don't talk about enough. So quick shout out to the folks that are supporting the show, Philly Soft Pretzel Factory in Langhorne. If you want to know, stop in there, grab yourself a free pretzel by just saying Play Free FC. Hill and Sea Company, built for that surf, ski, live free mindset. Don't have the hat on today, but sick gear, love it. And then last and certainly not least, Mark Frenick, YSC educator, Philly guy, soccer player, wrote a book called American Soccer Nation. If you love this game and where it's going in the country, you're all in the book. So definitely go check that out. All right. Excited to introduce you to Pete Zulia.
Yo, Pete, great to see you, man.
Yeah, Freddie, how you been? How you
I've been
been?
great. I've been great. So I really appreciate you hopping on here, man. You mean so much to me. So this is a great topic that you and I have spent a lot of time together, and we can get into that. I'm just happy that you can join this show. And
Same here.
I think it's going to resonate.
Yeah.
So let's start here. Give me the quick version of your story. Like, how did you get into this work, and what pulled you towards sports rehab and performance?
Well, in high school, I wanted to be a dentist, and I got a job going into my senior year of high school working for the Buffalo Bills as a ball boy, locker room guy, the whole bit. And
Shout out Bills.
Yeah.
Yep.
Number one. Yeah. And I was watching the athletic trainers. I kind of saw what was going on. First and foremost, when you're hanging out with your favorite football team, everybody's an icon. And then you realize that, hey, wait a minute, they breathe the same air that we do. They're actually normal people. And you can have some great conversations. And the backup quarterback to the backup quarterback at the time was a dentist in the off season. And I kind of thought, hey, that's pretty cool. And then what ended up happening is that as the training camp went on, and this is when training camp was 5-6 weeks. It wasn't.
So when was this? What years? You don't mind me aging you.
Yeah, I'm going to age myself. This was the summer of 1978. And so what ended up happening is that as I was kind of working and being around everything and seeing the back end behind the scenes of what happens in professional sports, I also saw what the athletic trainers did. And as a former athlete, I played football and I played baseball. You get injured and you start seeing what these folks do. And we're talking about close to 50 years ago. And I just thought to myself, hey, wait a minute, I could do this, I could stay involved, and I could help people. And what ended up happening was through some of my connections with the Bills, I'm actually one of my mentors, used to be the head football athletic trainer for VU's football team, West Virginia's football team. I did a visit. And just like you, Freddie, when you walked on campus in Oxford, the first thing you saw was, hey, I could see myself being here. And so I got ingrained in it. I was really into identifying with that aspect of sports because, let's face it, we all can't be the athletes we want to be for a long time because age takes its course and injuries and blah, blah, blah. But anyways, I did it while I was an athletic training student. I did some work in a private physical therapy clinic. And the notion was not only can I work with athletes, I could work with everybody if I'm a physical therapist. That's just the way the laws were. And so I went down that pathway and 2-3 years later went to physical therapy school and was lucky enough to look at options after I graduated. I had 6 offers coming out of school. My goal was to be as close to the ocean or to water as possible. And I chose
Miami, Ohio.
I chose the Ohio River, instead of the Atlantic Ocean. And it was a great move. I gave it 2 years. Things happened. It was progressing. Worked for a company for 10 years. And at the same time, my boss, who has been my business partner for the last 33 years. We both had this idea of, hey, we went up to Oxford from Cincinnati and started our own gig. And that's how it kind of evolved. being involved in athletics, being involved with the team physicians and the athletic trainers up there. That's how I meet someone like Freddie. We thought at that point, do we keep doing what we're doing in Oxford or we try to build on it? And so we chose to build the business. The cool thing about it after this long, Fred, is we haven't changed our business, our business as well as our treatment model a bit. It's the same patient-centered. There's not, even in this day and age where we have lots of insurance issues and time issues and whatever, the treatment is the same. The focus is this: keep the model of making sure that we treat the patient with everything we've got. And, you know, on the back end with the business side, we'll try to figure all that out. But that's the cool thing. And
that's awesome.
Last thing to say is, when you find people that actually share that same mission, man, that keeps everything in place. And one of the things we did with our company, statistically, we kind of looked at, we have over 60% of our people that have worked with us, that are still working with us, have been with us for 10 plus years.
That's amazing. That doesn't surprise me, knowing my experience.
That's the cool thing, you know, and so we go through all the pitfalls. So periodically over the years, I get this phone call from a former patient who's had a number of ACL situations going on, who played soccer. And the one thing that's genuine about this, and it's a fortunate thing for us, is the relationship that you bind with your patients. I mean, Fred, I haven't treated you in 25 years or more, you know, and we still stay in contact.
It's the maternal relationship. And I think, and for the listeners at home, Oxford is Oxford, Ohio, which is the home of Miami University, aka Miami of Ohio. And I transferred there from Drexel and already had one ACL prior to that, and unfortunately tore my ACL twice while playing at Miami, and then I think I had a third surgery, a lateral release or something like that.
Right.
And Pete and our friend Terry treated me for all those years. And I think it's interesting to share, Pete, going back to the relationship part. How many hours a week was I was with you? Hours.
Hours.
It was as much as class or anything else. And so you and I become friends.
Yep.
And here we are 25 years later having this conversation. And oh, by the way, it's not just I reached out to you, obviously, from the podcast. We keep in touch, you know, and you reached out about my son and called me about my son. And over the years, try to see each other. I don't get there as much as I can, but it's pretty special. I think it lends to what that means, to your point earlier.
Right. And in physical therapy, the thing that happens is this: when we see patients at their weakest point, and they're sharing a lot of their fears, their goals, and their aspirations, and they're looking at us as a way to get to their outcomes. And you know, this is a situation where we're perfect strangers, but because you're allowing us the opportunity to get in that personal space, because you have to be hands-on when you're doing work on somebody's injured body part, you got to respect that on our end, that you're allowing that to happen. And so there's a lot of confidentiality that goes in. The things that patients say to us that we have to keep confidential, a lot of it is fear. When you have an injury like this, and we're going to get into some of the things related to workout and warm up and those types of things, but when you share somebody at their most vulnerable point, if you can give them some guidance, some direction on how this could work. And again, remember, the human body, it's predictable, but it's not guaranteed. So however we know how a body is supposed to work, we give patients the idea so that the perspective of their rehab is as real as possible. It's going to be lots of peaks and lots of valleys. The goal is to stay as level as you can while you're working through.
Let's jump into it then.
Sure.
I was going to ask you some questions around like what's changed, but I think obviously technology and everything that is happening in your world speaks for itself. So like maybe let's zoom out for a second. And for our listeners, like what we really want to talk about today is ACL, and specifically women's ACL. So from your perspective, are we actually seeing more ACL injuries in girls soccer, or are people just paying more attention now?
I think it's a combination of all that. Title IX changed everything, and Title IX made such an impact on women and girls in participation in sports. And obviously we keep that focus in play, but also at the same time, there are some things biologically that may have some predisposing factors to, with a female, ACL injuries. And the reason is that the female anatomy, the pelvis is wider for childbearing, which makes the angle from the pelvis down to the knee, that angle between the thigh bone and the shin bone, is increased. And so there's a potential predisposing factor that could lead to those kinds of injuries because there's so much pressure being placed on the inside of the knee. And so that hasn't changed. What has built up over time and kind of evolved over time is not only being specific to one sport and trying to get an ideal effectiveness for those young folks as they grow and they want to try to do some sort of an exercise routine that builds to, the final performance that they want in their sport.
Out of curiosity,
Sure.
And maybe you're going there with this, one sport versus playing multiple sports. Are you seeing that be a problem?
I think that's a valid point. I think when you go from baseball or softball in the spring to tennis or track in the summer to, soccer or football in the fall to basketball, and every sport has their kind of designations of when they happen. In the old days, kids just went from one thing to another. And when we became more sports specific, that could be another one of those factors that adds into it. If we try to get to one answer, Fred, we're not going to find it, because the more research we have, the more questions we create. And at the same time, you got to also look at all the factors that go into play. Does the kid want to play a sport? What kind of factors do they not share with their parents or their coaches about things that are going on up here that may predispose it? My wife was a tennis pro, and my son, growing up, he wanted to play tennis and he wanted to be active in all kinds of things. And at one point he said to his mother, I don't know if I'm ever going to be as good as you. And Linda's response was, you do what you need to do to be as happy as you are. You don't have to play tennis. And emotionally, those things happen. And when you're a teenager, sometimes you don't bring that out. So that's the reason why the importance of a coach or that second person other than the parent or the family member is so critical. And that's why coaching, in my mind, is even more important now, because the emphasis on excellence in sports has really elevated itself.
Right.
And that's just because things have changed over time. All the things that we see now, when I was growing up, we had 3 TV stations. FM was kind of a cool thing. Who watches TV anymore? It's, again, that's how things evolve, and it's information. So here's the other thing about what we do. Information that's based on what you're trying to do to make someone's performance better might be good for one, but not another. And so that's where sometimes you have to kind of put some of those things in place. I'm 5'9", 170 pounds. I'm not going to be 6'8". I'm not going to be a power forward. It ain't going to happen. And so the realization of those things, that's where the guidance and direct communication between the young athlete and all their support system, from parents to coaches to teammates, everything has to be on the same line. And I think that emphasis has come into play a lot more, Fred, when the mental illness aspect of our game, our rehab, comes into play as well. So the more we know, the more we have to investigate. And the key thing is this: they're kids. That age group between 13 and 18, think about all the things that are going on in their lives that we don't even know about.
That's right.
And so if we can
it's
be
devastating too. It's devastating.
Oh, and you can remember something that somebody said to you. You could be, like me in my age. I remember stuff that people said that when I was a kid that didn't go well with me. And so those are things that I think also are in place. I think this podcast of what you're trying to do to really kind of give more information is phenomenal. And the hope is that people take this and be realistic with what they're trying to accomplish, not only with their kid, but also their team, where they're going to go with it. Is it important? How important is it? Because at the end of the day, win or lose, the benefit of what they're doing playing sports has to take on such an important impact later on in life. You being an athlete, me being an athlete, helps us in our own everyday lives and what we learned.
1000%.
And so that's why this is such a cool thing that you're doing here.
I appreciate that. And you bring up something that I think about it because I do wonder how my life would have changed without having 9 knee surgeries.
Yeah. Yeah.
And as a 18-year-old kid who had never been hurt, it was absolutely devastating. It took the one thing that I knew that I was okay at,
Right.
that I had confidence in completely away. It came
Right.
back, took it away, came back, took it away. And, you guys, you and Terry, obviously just were a big part of that. Like, I guess the mental part of it aside, like, let's get back to a little bit about, like, what are we still getting wrong about why these injuries happen? So I'm hearing anatomy. Is it strength? Is it mechanics? Is it workload? Or is it something just bigger around the athlete?
Yeah. It's a combination. That age group, they all mature skeletally at different times. So you may have 13-year-old ladies that have been developed much quicker than boys, and they want to perform. And women athletes and women's soccer players, specifically, in my experience, as a group, one of the most dedicated groups of athletes I've ever worked with. So those folks, they really do think of team. They really do think of how to best be a part of the success of that team, like a hockey team, same thing. And so I think that evolution can predispose them. The injuries that happen in females, there's a lot of documentation that says, are you wearing the right kind of cleat? Are you wearing, what's the environment that you're working with? Are you indoors? Are you outdoors?
Turf versus grass, like the new turf versus the turf I played on. Right.
All of that. And so all of those are now factors that either we didn't consider or we didn't emphasize, or there was no research on it. And so I think that it comes back to, okay, we got to be specific to the individual athlete, and is that work in unison with the team? And so warm-ups are really, really important. I think that anything that you can do to get ready as a clinician, we're trying to do things in our clinic. I call it the plastic environment. We're trying to maximize their performance to mimic what they do on the field. So if you're doing a single leg balance, just standing on a single leg balance, well, think about when that leg has to be balancing itself while your body is moving around. That factors into it. Then you have to throw a number of different challenges into just that activity. And you see athletes all the time that can stop and start on a dime. Well, they're balanced. They call it proprioception, which is you're aware of the way your body is aware of where it is in space and how it can react. All of those things are components to make sure that they can do a drill, make sure that they can do an actual movement on the field. And again, if you're in soccer, if you're a defender compared to a midfielder, compared to someone that's kind of just sitting there waiting for the ball to come so that you can kick it into the goal. Not that I want to say you were a forward or anything, but those are things that, again, the challenges of a midfielder compared to the completely different.
It's 360 degrees. You're kind of going in all directions. Maybe a forward. You're playing with your back to the goal, so you're receiving and turn. Yeah, agreed. Yeah.
The thing about the women's soccer that has always been intriguing to me is their determination to get back is as unique as any athlete that I've ever worked with. I think it's the sport. I think it's the participation. I think it's making sure that when you put that jersey on, they worry more about the name on the front of the jersey than the back. And that's always a challenge too,
You know what's been coming up? FIFA 11 plus. I guess that just keeps coming up. And is that real? Is that something that coaches can be doing to help?
Anything that you can do to get them to be preparing themselves for play, I think is a really good thing.
And that's FIFA 11 plus. Like, that's basically a preventative warm up that you can do for X amount of minutes prior to every.
Make it part of the routine. Yes. Yeah. And again, nothing is guaranteed because, again,
traumatic stuff like happened to me. Right.
All the factors can be in the play. But what you're trying to do is you're trying to minimize that as much as possible. Are you ready to play? As an example, when you went through your rehab, like any person that goes through an injury rehab, what you're doing is you're trying to get the basics back. You're trying to get your motion back. You're trying to get your strength back. You're trying to get your function back. And then you do drills and you do different types of progressions to get you back on the field. A basic ACL, the first thing you do is you got to make sure you're walking right. Because if you're limping right from the start, that's a problem that you got to take care of. Let's make sure you're walking right. Once you get that and you're getting your motion back and your knee is reacting very positively to the activities, is it swelling? Is it sore? Well, if it's muscle soreness, sometimes it's because you're asking the muscles to do things that either they haven't done for a while or you're challenging them. And so delayed muscle reaction or delayed muscle soreness is not a bad thing. And then you, again, educate the athlete and the parents that might happen. That's not a bad thing as long as we can kind of work through it. As you keep progressing, then you go from walking to jogging, jogging to sprinting, sprinting to changing directions. Then you start getting into things where you're making cuts and plants and all that change
Sport
direction.
specific.
Yeah. But also realize that while all this physical stuff is going on, you got to work on this.
Yeah.
Because the biggest
huge component.
Biggest fear somebody coming back is we are taking that athlete back to the same activity that caused the problem. So that's where warm-up comes in. That's where routine comes in. That's where sometimes when you do the warm-up, if the coach or the PT or the athletic trainer sees something that doesn't look right, you address it. But if you don't do that, you're never going to have that understanding. But then here's the other component of it. Someone's got to be watching the kids to kind of make sure that they're doing the right thing or they're doing the normal thing, you know? So again, it goes back to the fact that the more we know, the more we question. The more we question, the more we try to seek more answers.
Yeah. It's just being aware and present and having a kind of an open line of communication between the coach, the player, parent is important. You brought something up in prep about my mom and my grandmom. I can't believe you remember that. But like that's telling to you asking questions. And Mimi, my grandmother, God rest her soul, who was worried about me, didn't know what an ACL was, but asking me questions. And my mom, who's awesome, being there. And I guess what I'm trying to like, why isn't everybody doing it? Why is there, I'm a part of a club in town. I didn't hear about this until recently. And it's something that I shared with this specific friend that I'm talking to that I'm going to implement because I feel like I really want to champion this. Sounds like we're not doing it because people don't know about it. That's
one. Yeah.
So that New York Times article that came out, and I'll remember to put it in the comments or something. Really interesting article. It just seems like there's no consistency in messaging. And so like, I hear what you're saying. It's not going to absolutely prevent it, but proactively it could help.
Well, it could help. And at the same time, it's kind of that mentality of we know our own bodies.
Yeah.
And the sooner or later that we understand or we know our own bodies, the more that we feel like we can move and go to the next step of whatever the activity is. But more importantly, if something's not right, maybe that athlete says something ahead of time. Now they got to be legit about what they're thinking about because we're trying to be legit. But the point is that the more you're able to communicate, the more you're able to bring everything out, the more that the coaching staff, as one, is realistic and understanding, the more that the parents or the support system is realistic. And then more importantly than anything, can that athlete take all that information in place and actually be able to kind of start to think through this? Because remember, they're 13 to 15, 12 to, this is the age group we're really talking about, right?
Yeah.
That does that group even understand, what we're trying to accomplish? Because just think about all the things that, a teenage girl is going through. And so if we can be a support system, and this is where sports is so important, is it can really kind of help them gauge themselves and move themselves through a lot of things. Does that make sense too? I mean,
yeah, no, I think it's great. If I'm a parent listening, what's your biggest takeaway from this? Like if I have a 10-year-old girl, what should parents know? I guess we're kind of covering this, but how do I advocate for my child with a coach or a club to say, okay, there are things out there. This is a real thing. I don't know if you have percentages off the top of your head. It's a real,
Mm-hmm.
like women are tearing their ACLs at a crazy rate
Right.
compared to men.
Mm-hmm.
In soccer, lacrosse, insert name of sport. What's your advice to them in terms of like preventative? Yeah, of
First off, they got to enjoy what they're doing.
course.
The kid has to enjoy what they're doing. They can't be forced into it because, as you know, the more you get involved as an athlete, the more you are interested in that sport, the more you actually are investing yourself in it. And that's a fine line. The second thing that we have to kind of remind ourselves of is that when you start educating the athlete, you got to make sure the parent is involved in that education. This is our program. This is what we're trying to accomplish. Not only are we working on it from a individual perspective, but we're also working at as a team. Life is a team sport. We're teaching our kids to do something on an athletic level, but more importantly, we're really helping whatever the parents are trying to do. We're trying to make sure that they understand that things you do with others. And that team approach is also, that's a mindset. But the second thing is that you're also identifying a process. And in this case, you're trying to work on warm-ups. You're doing specific things that are you're going to take those drills, whatever they are, and they're going to be able to be applied to the field. And again, the difference between a goalie and a midfielder are completely different. So how are you going to make sure that those things are in play and
Yeah.
make it work right? And that's where that whole team process, where you have a warm up that now goes into specific positions, really comes into play. That's where the parents have to buy in, because if the parents buy into it, because who knows what they're saying when they're in the car driving home, who
Right.
knows what they're saying when they're at the kitchen table, and those are things that as a coach at this level is such a challenge, because what you say needs to be emphasized even more so when they're not on the field.
I want to kind of circle back to the strength mechanics stuff.
Mhm.
So is this a myth or is this real? Are folks quads or hamstrings one stronger than the other? Does that play into it?
Yes, it
And so
does.
I guess where I'm
Yeah.
going with that is, I'm a parent here in Wyckoff, New Jersey, and I'm thinking about preventative measures. I want to be proactive about it. I have a daughter who's playing. All right, we're doing the FIFA 11 plus warm up. The coaches bought into it, parents have bought into it. Great.
Right.
Now, there's a lot of like specificity training and individual training. Should we be thinking about holistic, like, okay, spend time in my quads versus my hamstrings, spend time in my core, because this all,
Right.
especially you were saying earlier, and tell me if I'm overstepping like my knowledge, but like there's a very specific difference between women and men, obviously.
Yep.
Can that help as well?
Absolutely, absolutely. The biggest thing that happens, that's always happened, is that the quad is that front thigh muscle. That is the thing that causes force to be placed on the leg that helps kick the ball. That
Mhm.
quad is so important when you're running. The hamstrings are obviously very important, and the relationship between the quadricep and the hamstring, the ratios of strength are going to be hopefully within. You don't want that quad to be too strong compared to the hamstrings. But again, here's another aspect that you have to remember. While all this is going on, they're still growing.
Yeah,
And the basic principle is bones grow quicker than the muscles, and the muscles
right.
have to follow. How many people that you work with, Fred, at that age have tight hamstrings?
Everybody.
Yeah, and it's because the bones are growing so quickly that the muscles have to follow.
Yeah,
Nice hamstring flexibility, good core strength, all of those are important, but then you also have to try to get and incorporate a little bit of hamstring strengthening. And again, it could be specific to wherever you're located. That stuff is very important too, because the mechanics of the knee is when you have an ACL injury. The ACL is kind of interesting because it's kind of a twisted helix,
mhm.
and it attaches. It doesn't attach like this; is attached like this and like this from the shin bone to the thigh bone. And again, I apologize for my anatomy is not the greatest when I'm trying to demonstrate with my hands.
I'm following you.
But the thing is that the joint works not as a hinge, but there's a slide and roll, and there's a rotational component while you're bending. That that ACL holds everything in place. When it fails, it's because the forces being placed on it, it can't sustain it while you're moving through. That's why in female, because of the pelvis, the angle down from the thigh bone down to the shin bone, it causes more pressure on the inside of the knee. And most non-contact injuries happen when you're planting the foot and you change direction. And when you change direction, the knee has to kind of go with it. And unfortunately, sometimes it fails. A lot of it is because the hamstrings have to try to help pull in place or have balance between the quad and the hamstring. There's so many different research studies on that proper strengthening, proper flexibility, proper sport-specific training, all of those things combined add up to making sure that you give the safety of that athlete and that knee the best shot. That's it. That's it.
Right. And what I'm hearing is like we can do all these things and it's still possibly going to happen.
It's a prevention. It's not something that's going to stop it from happening. And that article that you shared, that article really brings a lot of that into focus. I think it's always good to be able to warm up as well as cool down afterwards, not just the warm up part.
So yeah, I like that. Right.
And so that because just like yesterday when we're watching the college basketball, it blows my mind that these women or men that are playing basketball, they can't shoot a free throw. But guess what? The free throw that you shoot 10 minutes into the game and the free throw that you shoot at the 3-minute mark in the second half are completely different. Why? Number one, you're tired, and sometimes you can't perform that 15-foot shot the way you should. Well, it's same with injuries. Injuries can happen at the beginning, or it can happen because you're fatiguing. So that's where warm up and cool down comes in. That's where proper conditioning and sport specific comes in, and that gives it the best shot. And I think your idea of kind of following those guidelines, you're going to give those athletes the best opportunity to perform as well as make sure that they can prevent.
Well, that's my thought, which is like, listen, if it's one kid, two kids that don't experience a non-contact ACL, it's a win, right? Like, listen, my first ACL, a kid put his foot through my knee.
Yeah.
Second one was running and stepping on a sprinkler system at Miami of Ohio. Third one was like guy stepping on my foot. It's you can't prevent that. Right. But that being said, maybe some of the non-contact stuff, just that one person, and we'll never know. It's probably incredibly difficult to like study, but maybe XYZ doesn't tear her ACL because of that.
Well, and I think that's why this is such an important aspect of it, because coaches that are trying to help, like the youth sports, they're just trying to get kids active. And
Pete, they're not thinking about this. I'll be honest with you. They're not.
No,
they're not. Nobody's thinking about this until it happens to you. And you're like, why aren't we doing this? And it's an easy thing to do, especially for women, right?
And you're going to share that article. The guy that wrote the article, it's personal to him because it's about it. Part of it is about his own child. And as a parent, the last thing you want is for your kid to be in a situation where they're injured, But at the same time, all these things are in place. I think the one thing to take from it is the more you can prepare, the less likelihood of something catastrophic happening.
Yeah.
But it can happen with all the preparation, and so that's the kind of stuff that's in play.
Something you brought up is the mental side of it. I remember thinking it was just taken away from me and I didn't know what to do.
Right.
I didn't know what to do because that was my identity. And the thing I love, and what I did, and Coach Kramer was awesome. I came to every practice and I sat there and I learned how to coach. Silver lining takeaway. I came back, never the player that I once was. And I think about that more than I should. So it's a wild concept. So
well, it's like this, Freddie, and this is just something that I keep going back to. Had I chosen to take one of the other 5 jobs, I would have never met my wife or never had my kids. And the decision that I made was I took a job that was number 5 out of 6, and I just kind of knew that might be where I wanted to go. And sometimes it's just a matter of just making sure that whatever is brought in front of you, you take it and run with it. And so the most important person that his thoughts with me was my dad, when he said, if you don't try this, you're going to regret it. And if you try and fail, at least you tried. But if you don't do it, then you're going to always think, well, what if? And that made such a difference in me and how I work with patients, because that kind of reality of, okay, whatever's given to me, I'm going to make the most of it. And look what you've done. Even though soccer was supposedly your life, look what you've done with yourself. It would have never happened if you weren't injured.
I agree.
You know,
it taught me, I always had humility. I had self-awareness. It's weird talking about myself right now and saying that, but like I always had that.
Yeah.
What this taught me was like, things can be taken away from you. Just because you show up doesn't mean you win or you're successful. You got to show up and deal with the adversity that's given to you. Like, I know we have a little bit of flexibility. I want to do the Casey's Corner. All right. Let's see if this works. Ready?
Hi, Mr. Zulia. I have a question. Back when my dad was in college, did he think he was cool? Because he sure does think he's cool now.
Can I answer honestly?
How do we answer that question?
Out of the mouths of babes, the answer is yes, yes. And all I got to ask you coming back, Casey, is does your dad have leopard skin slippers, sandals?
Wow.
Yeah. Yeah.
Wow.
He was the epitome of just hanging out and having a good time and making sure everybody understood that he was okay. Yes. How's that?
I don't know if I like that segment anymore. Son of a bitch.
Hey, well, the good thing is that you actually shared the question, not knowing what it was. That was good. You know,
that was good. I wonder if Mom had a little bit of help in that one, but that's besides the point. All right, let's bring it back. Let's talk a little bit about like the after injury. What do families misunderstand about the road back? Specifically, we're talking about ACLs here. So I'm sure it's probably one of the more difficult things you deal with.
Yeah.
Because you talked a lot about communication with parents and coaches. So more or less like the reentry back into.
Well, the process. It's the process, the education of the process. Getting people to know. You try to you kind of forecast the process before they actually get into it, so that when they hit one level of accomplishment, then you start building the next level. You start working on certain things. And one of the things that's very, very easy to remind them of right at the beginning is after a surgery. Let's say someone has surgery. That first couple of days after surgery, the medication that's in that knee is still working. But then when that wears off, that's when the pain hits. And so I always try to educate our staff, or not only the patient, but the support system is, the first 10 days after a surgery, your body has just gone through trauma to like fix something that had been traumatized. And so if it's an ACL, they have to do something that works on the bone in your thigh bone. They have to do something that works, that do some drilling as well on your shin bone. And then you have to put that whatever your tissue that they're using to take the place of the original ACL, that's another portion that has to be in place. And then you have to fixate it. So the bone.
Do you have a favorite? Sorry, do you have a favorite? Cadaver, patella tendon, hamstring?
There's success rates with a lot of them. The biggest challenge, as you have found out, was when they take the bone tendon bone graft from your own tissue. That potentially could predispose some arthritic changes, short as well as long term.
Yeah.
But the idea of using that is the idea of it's the same tissue that's yours. Now, one of the technology things that's happened since is there's a technique called it's a bear technique. It's called bridge enhancement ACL restoration. And what they do is they take a plug, if you will, fill it with the blood of the patient. And then if the ACL has two ends that are actually close together, what they do is they put the filament in between, suture it together, and then now you have this filament that has the blood of the patient kind of connecting the two ends together. Now, the rehab is a little longer at the beginning because you want to make sure it takes. But that's a new technique that's happened over the last few years that's actually kind of helped the process. And again, those are things that have evolved over time, Fred. one of the benefits of using that technique is that you're not taking anything out of the body that's already there.
Yeah.
And the hope is that you're going to minimize arthritic changes, both short and long term.
Can I ask a question just out of curiosity? All this is like kind of coming at me full speed.
Mm-hmm.
Do doctors sometimes do what they're most comfortable with and they recommend that to the patients versus what is best for them?
Well, the best part is that when you have that kind of conversation, you ask those kinds of questions to the doc.
Yeah.
And if they feel comfortable with one compared to another, that's always something that you kind of have some consideration. The thing that the docs do very well now is, first and foremost, let's just say it this way. You have an athlete that injures themselves. Okay, not only is it physical trauma, but it's mental trauma. And they fear the worst. So when you have the diagnosis that's confirming the worst thought, okay, the last thing you want to do is just say, yeah, we're going to do this, this, and this, and it's going to be better. Okay, that leaves so many questions unanswered. And I think the one thing that is really good about today's physicians, for the most part, is that they understand that the trauma of the injury has to be kind of work through in your brain. You understand what's happened. And the next thing is that maybe you have another visit soon after that initial diagnosis and you prep them and say, okay, we just gave you some news that you didn't want to hear. If I give you all the information now, you're not going to remember anything because you're just going to know that you tore your ACL. So let's have another visit where we can talk through your questions and see how the best way to approach it is. Now, in today's medicine, I don't know if that's something that they do on a lengthy basis, but for the most part, if you have your questions ready for the doc, that's another education process. You know, the trauma of getting injured, Fred, as you know, I mean, that is all consuming for everything, you know, it's everything. And, you know, people don't realize that here you are, you walk onto the field, you prepare yourself for the sport, you prepare yourself for the challenge of the game, and then something happens and you can't do anything now. You can barely walk and you think about all the things that go into it. And so all of that has to be right. And that's where patient selection comes in. Sometimes being able to understand what has happened to you, and then you're presented with a potential number of options to fix it or to make it better. Again, nothing's guaranteed. I think that helps the mental aspect of dealing with an injury. And everybody reacts to the injury differently. Does that make sense? Am I?
Big time. And I guess I'm like, you rolled into something I've been thinking about, how much the confidence is such an important factor.
Yeah.
For a kid.
And with a doctor, that bedside manner is so important because they need to understand that, you know, for a 13 or 14-year-old female, soccer might be their world in their mind.
That's right.
You know, and so that's a
challenge.
The
parent is leaning on the doctor.
Right.
Because the average parent, I mean, we have Google and all that stuff now. Back then we didn't. But what did I do? 2 cadavers and a patella, something like that. I don't know. Everything around it has been caused by me just continuing to do stuff. Had nothing to do with the surgeries. The surgeries are great. I was very fortunate to have 2 great doctors, Kyle Simo and Dr. Greg out of Philadelphia. But obviously, at the time, sort of the forefront of ACL surgery, I would say. Things are changing. What, and again, going a little bit off script, what's the propensity of, I feel like, again, maybe me, but it was bad luck. You tear your right ACL, the chances of you tearing your left ACL. Is it the rehab, physical therapy, you're not strengthening that leg?
Well, and again, I can't remember, did they take the allograft, the graft off of your opposite knee or the knee that was injured?
It was injured.
Yeah. Okay. Again, whenever you have an injury to one limb, you're going to be putting more and more stress and emphasis on the other. Is that something that potentially can be that's a factor? I mean, that could happen. It's not a guarantee. It's not an absolute, but you kind of think, okay, I'm going to be relying more on the uninvolved or uninjured knee. But again, right foot, left foot. Most soccer players can kick with both, but if they have a choice of kicking with one or the other, you're going to use your dominant leg. Yeah, which means your left leg's going to play.
Yeah. And there's a lot of pressure in that plant, which you don't realize, right? There's a lot of force coming through that plant. Yeah.
And when you do that, there's all this energy that's being pushed to the inside of the knee. And again, it goes back to the mechanics of the knee and the rotation and the movement that goes into the inside of the joint, which stresses not only the ACL, but also the capsule or the covering around the joint on the inside, the ligament, the medial collateral ligament on that side, and of course the meniscus, which is that cartilage that we always have to kind of make sure of.
Which we don't talk about probably enough. Like you have these ancillary sort of factors happening within the knee, right? Maybe there's a little MCL damage, a little LCL. I got the acronyms right.
Yep, LCL's on the outside, the lateral collateral, right?
Goes on the inside, and then the meniscus, which is what I've been dealing with now too, right? So there's that invasive, like just sort of.
And remember, the meniscus to the layman, the meniscus is a spacer between the shin bone and the thigh bone.
Okay.
It's the construction is more specific and more dynamic than that, but it's basically a spacer between these two bones so that they don't push on each other.
Yeah. Kind of come back to the return to the wild.
Mm-hmm.
What is the difference between being cleared and ready?
Great question. Cleared means that from a medical perspective, you've hit all the boxes that you're having to go through to make sure you're medically and physically ready for whatever the concept is, or for whatever the challenges of that sport is. And the reason why you is you've gone through all of those, quote, plastic, things that we do in rehab to make sure that we can say that you're doing all the right things. You've gone through the walk, the jog, the sprint, the cutting, the sport-specific things, using the ball to make sure it's in play. Being ready is a completely different aspect, because now you're focusing not just on what you're doing, but the other people that are on the field with you, both your opponents as well as you, because you can't predict that.
You're at game speed now. Yeah.
Yeah. And so there's always a difference between the two. That's why with ACLs or any injury, getting back to play is one thing. Being able to perform, it's almost like I like to watch not only what they're doing that season, but then the next.
Play versus perform. That's interesting. Yeah.
Yeah. And so that's
back?
Yes. And are you back? Because remember, the mind is an incredible organ that can make you do things that you do, but also it challenges you, because think about it this time. The first time that athlete goes back onto the field to perform exactly what happened to them that injured themselves, they're going to have a question whether it's going to work or not.
1,000%. I wasn't able to come back until I got hit hard. And I went down thinking, oh my goodness. And I got back up and I was like, oh.
Yeah. And mom and grandma were probably there watching and making sure.
Yeah. This goes to another thing too. I'm sorry if I'm getting off track.
Oh.
I started wearing a Donjoy brace, and I don't know how significant that is anymore, but I remember I was sitting at Drexel and we were doing a team scouting.
Right.
They're like number 15 on Hartford wears a Donjoy brace. And I remember looking down and just taking my brace off and never wore it ever again and I played a lot of soccer since that moment ever. And I wonder if that was mental versus having the safety of having a brace on.
Yeah.
Which is side note.
Yeah. No. That's in play, because strategy is something that's very, very important. If you're watching a basketball game and you see somebody that's got a brace on, if you're the opponent, you're going to challenge that person. Yeah. You don't know whether they can do whatever they can do. And again, that goes into the psyche of competition. Sure. And anybody that's not played sports has no idea what the athletic mind can go through to get themselves through a game. Right. But that's why in our position, what we do with our protocols, if you follow all of our social media pages, I've got a knee problem, and it's an arthritic knee problem. And so the campaign right now is, how's Pete's knee? So today's episode is going to show that I mowed my lawn, and with a brace, I went out and I hit golf balls for the first time.
Good for you, bud.
And again, awesome. Trying to work through that. The idea is that we're doing it because I'm just an everyday guy now. And if I've got this problem, I'm guaranteeing you other people do too.
Looking right at me.
And there you go. And so those are things, Fred, that can make relevance. Think about this. You're going to talk about something to your athletes that you have personally gone through. And there's more relevance there than anything, because you're going to try to prevent that from happening. But if it happens, who are they going to talk to? They're going to talk to somebody that went through it.
Yeah, that's right.
And that's how important, that's important too. How important is that for you to talk to the parent about that?
My hope is that happens. I feel very excited to have that platform and to be able to share some of that, and folks like you and other people that I've worked with across the way can just be helpful.
And again, that's where I think wherever your community is, you find physical therapists define function better than anybody. So you find a physical therapy group or a company that focuses on those things, because one of the most important benefits of what we do is we get so involved in the community, and this is part of it. The most important thing for us is getting that patient back to whatever they like to do. So
why don't we we'll properly end it, but I guess I'm Pete. I've had X amount of years, which is incredible, decades of experience. You've seen all kinds of changes. We're talking about ACLs, specifically women's ACLs, but obviously men, boys do it as well. What would you say to a young athlete right now? Like what would be like your kind of takeaway, summing this up, to that person who wants to be proactive or whatever it might be?
Just like everything, what's the athletic mind say? The athletic mind is always challenged. And once they get a challenge, they want something else to be challenged with. And so my mentality is, number one, enjoy what you do.
Mm-hmm.
Understand that there may be challenges physically that you have to work through, but use that same mentality when you have an opponent that you're trying to work through or go past, or whatever the sport is, and use that same mindset when you have an injury.
Mm-hmm.
Okay, so if it's a women's soccer player, instead of being the defender that makes sure that while you're right here, peripherally you're watching because someone is kind of coming to the side there, you're going to make sure that you kind of drift that way, okay, because you want to challenge that person to make sure that, number one, they don't get the pass, and number two, if you intercept it, you send it up to your teammates. The challenge is getting there, okay? Yeah. Use that same mindset now that says, okay, I just injured myself. I'm going to use that same mentality to get me through every step along the way of rehab, so that not only I can be cleared to play, but then I can be ready to play.
I love that. That's great. That's fantastic. Pete, where can people find you and learn more?
There's a couple of things. First off, if you want to follow us on any of the social media platforms, Oxford Physical Therapy, that's pretty cool, because it talks about all the stuff that we do, Freddie, literally on a weekly basis. How's Pete's Knee is the campaign.
I love that, by the way.
It's actually pretty good.
It was good.
And we're using the combination of electric stimulation and dry needling to really kind of help to get it in place. OxfordPhysicalTherapy.com is our website. There's a lot of information there. There's a lot of information on any of those kinds of sites that kind of gives the patient or the patient's families an idea of what's going on. We have a podcast, and the podcast is direct access to Oxford Physical Therapy. Information is critical. Information is power. But I think the one thing that you've got to realize is that what you do with that information, number one, it's got to be validated.
Yep.
And then whatever you're trying to accomplish, you implement. And then the best part is, after it's implemented, then you go back and see, is it effective?
I love that. This isn't just about injuries. It's about kind of responsibility. And if we know better, we can do better.
Well, that's exactly it. And you know what? The best part about it is, Fred, the people that we treat in our offices, I mean, we got 11 offices in the region, and the dynamics of the differences between personalities are the spectrum. And the goal here is that they can use us as kind of the conduit to getting themselves better. And that's what every day just gets me fired up to work even more.
I love it, dude. This is awesome. Pete, I appreciate you so much. You'll never know. So thank you for coming on, man.
Thanks, Freddie. I really appreciate it. It makes my day when I can talk to you.